Hello, and welcome to the video series on understanding culturally and linguistically appropriate services. This video is on the overview of the principal standard. The objectives for this learning session is as follows. During this session, the participant will be able to examine why the national class standards are important, describe the principal standard, and explore different approaches to implement the principal standard. Our goal is after this video, you'll be able to have a high-level understanding of the whats, the whys, and the hows of the principal standard. So for a little bit of background on what are the national class standards. The national class standards were first implemented in 2000 by the Health and Human Services Office of Minority Health to help address and reduce racial and ethnic health and medical care disparities. After feedback from public forums in 2013, the standards were revised to what we have today, increase user-friendliness and broaden guidelines. National class standards were developed to ensure the availability of culturally and linguistically appropriate health care and medical services of anyone and everyone who needs care. CLAS provides organizations with 15 action steps intended to advance health equity, improve quality, and help eliminate healthcare disparities by establishing a blueprint for health and healthcare organizations. There's no single correct way to implement the national class standards. An organization may decide to implement some, but not all of them, or they may wish to implement some standards sooner than others. This video will focus on the first standard, or the principal standard. The principal standard sets the stage. It calls on organizations to provide effective, equitable, understandable, and respectful quality of care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. Standards 2 through 15 represent the practices and policies intended to be the fundamental building blocks of culturally and linguistically appropriate services that are necessary to achieve the principal standard. For this reason, strategies for implementation specific to Standard 1 are not listed here. If each of Standards 2 through 15 is implemented and maintained, organizations will be better positioned to achieve the desired goal of equal, equitable, understandable, and respectful quality of care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. So in other words, the principal standard is the end goal. It takes everyone's awareness and participation of CLAS to ensure success, and all of the standards support and improve the work you're already doing and provide a guide to improve better services to your patients. By addressing standards 2 through 15, it helps you achieve standard number 1. In closing, health equity is the attainment of the highest level of health for all people. Culturally and linguistically appropriate services are increasingly being included or referenced by local and national legislative, regulatory, and accreditation mandates. Both the Joint Commission and the National Committee for Quality Assurance have established accreditation standards that target the improvement of communication, cultural competency, person-centered care, and the provision of language assistance. CLAS is a way to improve the quality of services provided to all individuals, which will help reduce health disparities and achieve health equity. Meeting standards 2 through 15 are necessary to achieve the principal standard. That concludes today's video. If you have any additional questions, please do not hesitate to reach out to Superior Health Quality Alliance.